Today we are going to be talking about AIDS in Thailand and AIDS prevention in Thailand. AIDS is the acquired immune deficiency syndrome. It is caused by the HIV virus. Most people get the HIV virus by having sex with an infected person without the use of a condom, sharing a needle with someone who is infected, and being born when the mother is infected with HIV. Today there is no known cure for AIDS. In Thailand, there are currently 440,000 people living with HIV. There is a 1.1% prevalence of those with HIV among adults aged 14 to 49. It is found that 430,000 people aged 15 and up have HIV, and that the death per year is 21,000 for people that have HIV. Since 1984, it has been generally accepted that HIV is mostly transmitted sexually. In June 1989, the Ministry of Public Health found 44 out of 100 prostitutes from 7 brothels were found to be positive with HIV. They found to be a strong association between HIV contraction to increasing frequency of sexual intercourse, lower charges for sexual service, lower rate of condom use by male clients, and genital cleansing with water alone. It is found that in 1993 that there are more cases of HIV were transmitted from female to male. In Thailand, there have been many strategies to reduce AIDS because in Thailand it is they have the highest prevalence around the world. In 2012, they started a new strategy called Get to Zero. This addresses 2 critical questions. 1, what is Thailand doing well that should continue? And 2, what needs to change to get 0 new HIV infections? This plan has 2 main strategic directions. The first is innovation and change, and the second is optimization and consolidation. What is meant by innovation and change is that it focuses on promoting strategies to better address the socio-environmental factors which hinder access to HIV prevention and care services. And what is meant by optimization and consolidation is that they aim to at the continuation, optimization, and sustainability of proven programs already carried out around the country to prevent AIDS. The goal of this program is to reduce new HIV infections by 2/3 by 2015. They want to eliminate new HIV infections among children. A lot of countries around the world are trying to use the same strategies as Thailand. The ASEAN heads of state adopted a declaration to get to zero on HIV. Then we also have a 3-minute video here.
So the results from the various methods that Thailand has used to try to control and stop the infection of HIV and AIDS has definitely worked to some extent. Sex workers have shown increased usage of condoms, and well over 200,000 estimated cases of HIV infection have been averted since a lot of these plans have gone into effect. And the number of new cases has dropped 5-fold as they would have been estimated by 2013. And one man that is responsible for a great deal of these strategies is Michi Viraveda, who started the world-famous condom campaign and is often known as the Condom Man. He sought to focus on education and promote acceptability of condoms and make them a less taboo word in society, as well as promote the usage of them from children to women, including prostitutes, drug users, and anyone that was considered a high-risk population. And this has significantly lowered the rate of infections and is responsible for much of those 20,000 cases that have been averted. A lot of the dilemmas that come up with controlling the AIDS and HIV infection problem in Thailand include that certain populations remain hard to reach. Lower socioeconomic people, for instance, are significantly less likely to be involved in the education programs, and these include prostitutes, drug users, and certainly men who have sex with other men, which is called MSM. And there's been a decrease currently in the importance of education of condom usage, while Thailand was #1 in the world for promoting condom usage and safe sex and prevent HIV. The numbers have gone down significantly since they saw their peak several years ago. And the number of infected individuals remains high, and there's been not enough funds dedicated to combating AIDS. It's estimated that 30% of the GDP in Thailand would be required to combat AIDS effectively, while only 15% of it is currently in use, which is significantly less than it had been in previous years. One researcher is quoted as saying Thailand has lost its reputation for dealing with the disease, and the battle still continues. It's estimated that 43,000 new cases of HIV will erupt in Thailand this year. About 50,000 Thai people currently have HIV, and there are 25 new cases of HIV in Thailand today. To promote or to combat this, we need to continue to seek low-cost ways to educate, prevent, and treat HIV in all populations in Thailand.
All right.